Dr. Snyder joins us this afternoon, Peninsula Regional Medical Center's Chief Quality Officer, also the Chief of Peninsula Regional Health Systems COVID Response Team. Good to see you, Doc.
It's good to be back with you, Jimmy. You look great.
Well, thank you. From here at home, which leads me to the question. The numbers on Delmarva, does that mean at least we're getting closer to being in the clear?
Well, clear's we're not sure, but yeah, absolutely. We have a lot less hospitalizations. Our units are back to normal here at the hospital. We still have one or two COVID patients being admitted every day, pretty much. The good news is the mortality rate. We're not seeing COVID patients dying anymore, which is fantastic. So the virus has, I think, done a lot of its damage in our community and is kind of tapering off. And I really don't think it's going anywhere. I think it's one of those things we're always going to have, much like flu. But we're learning a lot every day, and you're absolutely right. Now, the numbers are kind of difficult because there's a lot of testing going on, some of it with symptoms, some of it without symptoms, and not sure what all that means yet. But CDC is keeping us up to speed with that, so is Department of Health.
So why do you think we're seeing such high numbers every place else?
Well, I think that, again, they're testing a lot. So you're going to see the asymptomatic patients. I'll be honest, I'm not as worried about asymptomatic patients. We don't even know if they actually spread the illness. So the virus doesn't necessarily spread if you're asymptomatic. You have to have enough virus on board, and then you have to have enough exposure to the virus in order to cause illness. So, again, that's different for every animal. We are animals. So it's different for every human being and how they deal with the virus, and your immune system is learning this virus, much like it does with other viruses that are out there.
Right.
And again, this virus acts a lot like the flu virus. It really does, same kind of symptoms. And again, the flu kills also. We have to. It's going to have probably that kind of, and again, I'm speaking out of line because we don't know, but probably going to have a similar experience with coronavirus over the next decade that we did with flu early on.
So you don't think it's ever really going to be a thing of the past? We're never going to really be done with it?
No, we're not going to be done with this. This virus is here to stay, and it's one of those things that we're actually accommodating here at the hospital very well with our COVID rooms and our isolation process. So we've dealt with tuberculosis, polio, HIV, just list goes on of viruses that we've always had to deal with, and bacteria. So again, I think it's important. Infectious disease is some of our daily things. That's why we have so much sepsis, et cetera. So this is just another pathogen that we're going to have to keep ahead of. And as we learn through science, we'll get better at managing it. Currently, there's really no treatment that's effective for it other than supportive care.
So we have seen several examples of people who have healed at home. They've recovered. What kind of symptoms, what kind of things should we be looking for?
Well, again, it's the flu symptoms. So the fever, sore throat, achiness, cough. And again, the shortness of breath is really when you're starting to get in trouble. And that's when our unfortunate high-risk patients, like emphysema patients and heart failure patients, cancer patients, all, they need to heed the warning. We still have to protect that population. This virus, much like the flu virus, can be deadly in an immunocompromised patient or a patient at risk for lung disease. So it's a nasty virus when it gets into folks like that. And that, again, is the majority of our mortalities were over 65. And that's nationwide. We've seen that. So younger folks just don't get that sick with it. And they have 3 to 10 days of illness, and then it resolves. And we're hoping that immunity builds with that. And, and I do believe that's a big reason. I think this virus attacked the unfortunate population who didn't have a good immune response to it, and that's why we had such a high onslaught of illness, and the severity of illness was much higher in the beginning.
So what's your number one message to people regarding COVID-19?
Continue with the hygiene. I can't stress it enough. Our elbow bump, we've been talking about for years on this show, and it's real. And I'm really, if there is a silver lining here, I think people are cleaner, and I kind of tell people, make sure your circle, your family circle, your work circle makes the effort to keep your work circle, your family circle clean, hygienically, with hand hygiene, with wearing a mask, and preventing those things. But I think prevention's worth more than a pound worth a ton of cure here. And again, it's showing, and that's why we had less of a surge. That's why we had less of a pandemic event, because we really did isolate and get folks protected early on. We have to keep up that, because the virus is still in the community and it's not going away. I get positives every day coming through the door, and it's one of those things we're just gonna have to make aware, and do contact tracing and make sure we're testing those folks who've had exposure.
And do what we got to do. PRMC's Dr. Chris Snyder taking the elbow bump a step up to the virtual elbow bump. Dr. Chris Snyder, thank you so much for your time with us this afternoon. It's great, as always, talking to you.
Take care.